Hey everybody.
Oh hi, it's Dr. Rachel.
Dr. Annie.
Wise Wellness, we're back.
We're back. Another Wise Wellness.
Another Wise Wellness.
Wellness Wednesday is what I meant to say. Today we're talking about at-home exercises that you can do to support your pregnancy and help hold your adjustment.
Yeah, we get a lot of questions like, is there anything I can be doing at home? And we give you all the tips, but at least here's not like a video you can refer back to.
Yeah.
Yeah, you can watch me do them all.
Link you to too. Also.
So these are mostly from Spinning Babies. I took a Spinning Babies seminar way back before the pandemic.
Yeah, it was also part of our advanced prenatal training that we did too.
We got a lot of it in another
ICPA course.
Yeah. But like when I went, it like blew my mind the stuff those people know and things they can do to like help you through your pregnancy. Mm-hmm. So I always recommend people find someone to support them in their pregnancy who knows Spinning Babies, because it was pretty.
Lots of doulas know the stuff too.
Yeah,
lots
labor
of
delivery nurse, midwives, they were like all at the seminar I went to. Sorry, we're like squatting.
Yeah,
because
we had to have the right angle for the table.
We have to use the table. So this is all going to support after your adjustment to help keep round ligaments relaxed.
Yeah, keep your pelvis in alignment.
Your pelvis in alignment, psoas nice and stretched out and relaxed, so that baby can be in best position, and then helps with any like pain issues.
Oh yeah, exactly. Yeah. Muscle tension, anything like that, any imbalances too.
Yeah, a big thing for pregnancy is keeping that psoas. Psoas is huge. We work on it always in pregnant women. But keeping that nice and stretched and relaxed. So there's quite a few things you can do at home for that. Mm-hmm. Okay. Which one do we want to do the inversions first?
Sure.
Okay.
And then I can describe it as you go through.
Okay, so inversions are super popular with breech babies usually. Mm-hmm. Like that's what most people know it for, is like getting upside down to help relax that pelvis to get baby to turn. So we always recommend it then with the Webster technique, but also
if baby's not fully engaged in the cervix too.
It's not fully engaged, but with breech you do it like many times a day. But I also recommend it to all my pregnant women to just help relax the pelvic floor, the round ligaments, the psoas, and just to do it once a day. Like I said, it's going to help support what we're doing here when you go home, because it just does. So
it helps all that.
Yeah, so once a day, and it doesn't have to be long. Someone's like, I tried it staying out there for 3 minutes. It's literally 3 deep breaths you stay down there for like 30 seconds.
Not
it's
a
not
long
long.
time. Yeah.
So we'll show you how to do that, because I usually show mamas in here, but like I said, it's good to then have a reference.
So our table is higher than what you would generally want to do it on. This is, you would do this off of your couch or off of your bed, something like that.
Yeah, you'll see me struggle because I'm short.
It's a high table too. Yeah, for us to adjust.
And you want someone to help you. I always say have your spouse, someone there, especially the first time trying it. The bigger you get, because you are going to go upside down. Yep. Okay, so you start here kneeling, back on your heels like this. So I tell you when you're going to start here, you're going to end here. So this is how you start. This is where you're going to end. And at first, and I'm going to have Annie take over as I go upside down, but at first we go down, and we're going down to our hands at first.
We're going really slow.
Yes.
So
you could
it's going to feel pretty uncomfortable at first.
Yeah, if you're scared to go right down to your hands, you can put a stool or something to get your hands to first, as an intermediate step, and then go to your hands.
A chair to climb down.
Yeah.
Yep, so we're going to go all the way down
to our hands. Yep. Can you see that?
Yeah, I'm going to move the camera just a little bit. So.
And then from here, we go down to our forearms, and then tuck our chin.
Yep, so you tuck your chin. Do you want to make sure? Nope, the iPad fell. All right, sorry everyone. Sorry if that made you dizzy. Okay, so let me hold the camera here real quick. Rachel, you're doing great with your 3 deep breaths. So you tuck your pelvis. You want to make sure that your spine's in a straight line, and tuck your chin as much as you can. And take your 3 deep breaths, and then you can start to come up.
You come back up on your hands.
Yep.
Walk back like you might need help with this.
Yep.
Remember, you have a belly.
Yep. Your spouse can also give you a hand. You can climb back up that chair. And now it's just on our feet.
And then you come back up, and like I said, you're going to end here also. You want to sit here you just went upside down, right? You're going to kind of get a rush of blood. So your head might feel a little pounding, that's normal. And just sit here and take a couple deep breaths. And then the more you do it, the more your body's used to oh, I'm going upside down. You shouldn't have that so much.
Right. Yep.
There are contraindications to this. You wouldn't do it
if you have high blood pressure.
High blood pressure. If you have one of those people that have horrible heartburn, it's not going to be great for you.
Yeah, it doesn't feel good. Yeah.
But the Spinning Babies website has great
alternatives.
Yes.
For that. Yeah.
Okay. So that's one.
Yep. So that's number number one. Second one that we recommend to moms that we'll do too in our office. So most of our pregnant moms, like especially in third trimester, we do this with them and then we show them.
Yeah, because we're trying to, like I said, we're trying to get your body ready to have like a super nice labor.
Yep, exactly.
So this is also, it's called Sideline Releases, also for the psoas. So we do it here. You can do it at home with your spouse. I tell people this all the time.
Yep.
Now you got a video to show them.
Exactly. So when you start off laying on your side, we want to make sure that your shoulders are stacked and hips are stacked. So again, your spine is nice and straight.
So you're not laying like this.
Yeah.
A lot of people like to like lay like
we
twisted.
don't want torquing in your low back or in your pelvis when you're pregnant. So this is what we do. Your partner or spouse is going to, we're going to stabilize your hips right here by just putting some light pressure down. And then we're gonna bring this top leg forward and drop it right off the table, keeping the hips stacked here. So you're just like supporting the hips.
Yep, and
right
you want the bottom leg straight also. If it's bent, it's in the way.
Yeah.
So when I straighten it, I guess I didn't even realize I had mine bent, you can get the leg off the table a lot better.
Yeah.
And then this, like if you're like, oh, I feel like nervous, I'm gonna fall off, place your hand, so Andy can come a little closer to me. I always tell people you can place it, like, so my hand's on your hip, their hand's on your hip, and it kind of just like helps hold.
And you're stabilized here. So then we tell our moms to take a couple of deep breaths in, focus on relaxing your pelvic floor. So this is to help relax the pelvic floor. This is gonna help relax the psoas muscle too, which is attached to this front hip, and then also the inguinal ligaments too that attach to the front of the pelvis here.
And then just do it, and you can do it on both sides.
Yep.
Also, which when she just said like relax the pelvic floor, that's a good reminder. Like I didn't even realize I was like clenching into a kegel.
Yeah.
Because you're like in that position, you're kind of nervous about falling.
Right. So that's something that's important. Like any of these exercises, like baby's not gonna fall out. You want to focus on relaxing your pelvic floor because that's a good practice to get into.
Okay, and then another one. Let's say your spouse isn't home and you don't have help to do a sideline release. Another way to like stretch that psoas, which I show people in here also, to lay on your couch or your bed. Okay, lay down. And then the leg that is not on the side of the bed, you're gonna bring that like knee up to your chest and hold it, and then this leg is gonna hang and you're stretched through here.
So you're stretching your psoas muscle again, which attaches to your low back and the back by your lower ribs, and then attaches to the front hip too. So
and
that's what that muscle.
Your low back should stay on the thing.
Yep. You want to try to keep that flat. Yep.
This is a good stretch, and you can do both sides.
Yeah, and if you have a yoga strap or something, that's a good way to like get your foot up to you too, especially if your belly is really big. You can also bring your leg like outside of your belly.
Yeah,
too. Yep.
Okay. So those are good stretches that can be done daily.
Yep.
Other things that the spinning babies really recommend is like squatting to get ready for labor, to relax your pelvic floor, and they recommend doing like lunges, like lunging before to get your pelvis ready before squatting.
Yep.
So it's not like super like I don't know.
You're not doing like athletic lunges.
Yeah, we're not like lunging like this. It's really just more like foot in front, back, kind of like stretch there.
Yep. Again, stretching the psoas muscle too. On that
So
side.
that's like another way to do it.
Yeah. Warm things up. We talk so much about the psoas muscle during pregnancy too because it gets so tight. So as your center of gravity is shifting, your belly's growing, we tend to like bring our back like this and dump more into like our pelvis and stuff like that, which shortens our hamstrings, really engages that psoas muscle. So it gets really tight. So that's why, and that one is really important for like during labor process and stuff, and also allowing baby to get into the right position. So we want to make sure that like we are really working on those psoas muscles, stretching them out.
And then for their squats, what they recommend, it's not like also like squats like you're thinking of. Like squats are great to do to strengthen your legs and glutes and everything for labor. Like
so
if you're planning
like
on
traditional squats,
moving during labor, being in positions, maybe squatting or all that, like traditional squats, like those are great. Like start doing them. But their squats that they really recommend are more like
kind of like chair pose in yoga. So your feet are going to be facing straight forward. And then when you go down, you want to really push back into your heels and push your booty back so that your knees stay above your ankles.
And they recommend having like a partner here to hold your hands.
Yeah,
right
around the table.
Once again, pregnant. Like,
So
like
partner
this.
here
Awesome.
to hold you up. Or you can do it on like a countertop, a doorway, something like that. Yes. So to give you more balance.
Yeah.
Yep.
Other good ones to do are hip openers, which I was just doing while Andy was talking, you know, so the cross your leg over, take your hand on your knee, stretch that. You can do it as a figure four, like a
Yeah,
laying on your
thread the
back
needle on your back.
if you can still be on your back.
Yep.
Yeah, thread the needle. Like you see my legs crossed as you bring your hand through, pull this leg closer.
Yep.
You're gonna feel it a lot more here. So if you're not feeling it while you're seated, do it this way.
Yeah, this is also the same as like pigeon pose in yoga. This one's really good for your piriformis muscle, which is usually the culprit in pregnancy-related sciatica.
Yes.
So if you're getting like that shooting pain, numbness down your leg, that would be a really good one for you to do. The piriformis is like a pelvic stabilizer muscle that gets really engaged during pregnancy too.
And like I said, of course, all of these go really well with getting adjusted.
Yeah.
You know, like
we put you back in place and then
we're gonna get like none of this is going to align your pelvis.
Yeah.
But it will like help stretch and relax those muscles to keep that pelvis alignment.
Yeah,
which
exactly.
is huge, which you talk about many a times. We need good pelvis alignment to help with like have a better, more comfortable pregnancy, but also like I said, the big important thing is to get baby in best position.
Yeah, because that determines basically the outcome of your labor.
Yes, it can.
So, all right.
I think we talked really fast because that's what we do.
Yeah. So if you have any questions,
let us know or more. Like we can go over some. So people will get like neck pain. We see a lot of mid back pain with pregnancy, just like the way people are carrying.
Yeah. Center of
so
gravity again. Yeah.
Stretch us through that next time or something.
That's a good idea. Yep.
Okay.
Stay tuned for more videos.
More videos of us hanging up upside down. All right. Awesome. Thank you so much. Have a great Wednesday.
Bye, guys.